tomorrow, as some persons have been reporting. So there is no need to rush to the store. I cannot emphasize enough that there is no need to panic buy any items, as we're going to ensure that the supply happens. Yesterday, I indicated that we will allow limited restocking of these particular items in our stores, and the Minister of National Security and the amendments that are being made to the emergency powers regulations will allow for that to happen. As this government sees needs that must be addressed, we will always look at issues carefully, and we will need to make if we need to make a different decision while maintaining the health and well-being of Bermudians, we will. I cannot stress enough that an overwhelming majority of our people are putting Bermuda first by following the rules, sheltering in place, and maintaining social distance. Yet there are those who continue to act in an undisciplined, reckless, and thoughtless manner, as was just stated by the Minister of National Security. For them, the only solution will be face the consequences before the courts of Bermuda, and that is not something of which we want to do. So if you do not care about anyone else, I hope that you will at least pause at the thought of paying thousands of dollars in fines or potentially finding yourself behind bars. Given we are dealing with people's lives, the government is not playing in this particular situation, and we are urging the Bermuda Police Service to continue to enforce the law as it is written. Now, Minister of Education, Diallo Rabane, will provide an update on education. Minister.
Thank you, Premier. Good evening, Bermuda. We know that this time is not easy for anyone, and we are keeping our students, family, and staff at the forefront. I'm in awe in the efforts being undertaken by our school and system leaders, our parents, students, and other community support agencies as we navigate this difficult time. It is also important to reiterate that our priority is to ensure the health and well-being of our students, family, and staff. Therefore, schools will remain closed until further notice. Now, in light of the extension of the shelter-in-place order until May 2nd, it is necessary to provide an update for our education family on several education matters. These updates will focus on remote learning, school registration, the Cambridge International Examinations, and senior school graduation requirements. I'll begin with remote learning. Again, I would like to say that our principals and staff are to be commended for their commitment and continued efforts to facilitate the learning of our students during school closures. With the decision to extend the shelter in place, our teachers will be ready to resume the remote learning program for students from preschool level to high school level starting Monday, April 20th. Senior schools will continue with teaching the essential curriculum for each of the courses students are currently taking, while the primary, and middle schools will focus on learning activities on content and skills that have already been taught. These three levels, in addition to our special school, Dame Marjorie Bean Hope Academy, and the Success Academy at Roberts Avenue, will all implement a remote learning strategy that is responsive to the shelter-in-place conditions and that considers the most current research for remote learning. More specifically, the learning activities will focus on three key areas: academics, physical activity, and student well-being. This week, our student leaders collaborated and agreed on common schedules and expectations for the remote learning program. Parents will be provided with information on what is to be expected at each school level while the remote learning strategy is being implemented. School principals will provide this information to our parents and guardians tomorrow, Friday, April 17th. School registration. As a result of COVID-19 and the shelter-in-place requirement, there has been a delay in notifying parents of the enrollment decisions for first entry into primary, middle, and senior school. Instead of receiving the usual letter by mail, parents will now be notified electronically. Parents of students who will be entering Primary 1 will receive a letter via email on Tuesday, May 5th. Parents of students entering S1 will be notified on PowerSchool, the student management system, on May 7th. Parents of students entering M1 will be notified on May 12th, also by PowerSchool. Middle and senior school parents will be required to log on to PowerSchool to access the enrollment decision. We look forward to welcoming new children into the Bermuda public school system in September 2020 and providing support for those students transitioning to middle and senior school. I will now speak to our Cambridge International Examinations. I am pleased to report that students at our middle and senior schools who were registered to sit Cambridge IGCSEs and A-level examinations for June 2020 series will still be positioned to have grades awarded for work completed in these courses. On March 23rd, Cambridge announced that they will not hold have been in discussion with the Department of Education officers to consider adjustments to the graduation requirements while maintaining the standards of the Bermuda School Diploma. Recommendations are being prepared for the submission to the Minister of Education, and the decision on the recommendations will be shared with parents and students by the end of next week. In closing, I want to briefly provide an update for our students about the ministry's scholarship and awards offerings this year. We know that it is also a concerning time for students planning to start college or university or to studies in fall of this age and will run for another week. Additionally, if you email scholarships@moed.bm, the survey link will be sent to you automatically. Any questions and feedback can also be sent to scholarships@moed.bm. The Department of Education and the Ministry of Education will continue to provide updates through its Facebook page, email, school apps, social media, and the website www.moed.bm. Thank you.
Thank you, Minister. I would like to thank you and your team at the ministry, the department, Bermuda's principals, educators, and paraprofessionals, not just the Premier, but also as the father. As a father, my daughter is enjoying her experience learning online, and I'm grateful that in spite of this pandemic, she, like so many of our children across the island, has the opportunity to engage in learning. I am very pleased to share some good news with you. In a press release that was issued a few hours ago, Athene, Bermuda, announced this afternoon that it led a joint effort of companies to fund the purchase of 8 additional life-assisting ventilators for the Bermuda Hospitals Board. Together, the companies donated more than $400,000 to fund the purchase of equipment that is critical to patient health, especially during this pandemic. The joint effort led by Athene is being made possible by the additional support of several other Bermuda-based companies, including Athora Holding Limited, Aspen Insurance Holdings Limited, and Catalina Holdings Limited. Widespread shortages of essential medical equipment have created a challenge for the hospital. The Bermuda Hospitals Board identified that there was a need for these additional ventilators, and this group of companies responded. Athene, speaking on behalf of all the supporting companies in this joint effort, said that it was an honor to give back to the community and also expressed how grateful they are and supportive of the healthcare professionals on the front lines treating patients during this extraordinary time. On behalf of the government and the people of Bermuda, I extend a sincere appreciation for the generosity of these companies who have paid for these life-saving ventilators. As we entered 2020, no one could have predicted or imagined that we would be confronting the global emergency we are facing today. The world has been forced to change, and so we have been forced to change. It has been said that the true character of a people is not revealed during times of prosperity and happiness, but during times of crisis and woe. We are pulling together as a people. Our healthcare professionals on the front line are working tirelessly with those suffering from COVID-19 and treating them with dignity and compassion. I must also add the professional and technical staff at the Mid-Atlantic Wellness Institute. They continue to play a vital role for those who need ongoing and additional mental health support. Whether it is our bus drivers and members of the community working to ensure that our healthcare professionals don't have to worry about when or how they will get to work, our teachers, many carrying the burden without complaint or reluctance as they educate our children while caring for their own, our dock workers, truck drivers, grocery, pharmacy, and gas station workers helping to keep us fed and the medicine we need on our shelves, the bus drivers and the security guards who are working at the various stores to make sure that social distancing rules are being followed. There are so many that are working without recognition, quietly behind the scenes, to get us all through this difficult time, and to them, I say thank you. Finally, tonight, I extend my warmest thanks to the members of my cabinet. While I, the Minister of Health, and the Minister of National Security have been before the cameras throughout this national emergency, every single member of the cabinet is working hard and doing their part to ensure that government continues to function, continues to listen, and continues to adapt to the swiftly changing circumstances our island faces. I say thank you to them, and I say thank you for your attention, and happy to take any questions that members of the media may have.
Good evening. How are you? My question, I don't know who's going to ask this, but who gives the approval for a list of persons who can bring in test kits? If so, is it made public?
I'm sorry, who gives the approval for bringing it?
Who authorized, who gives the approval for just anyone, say Joe Blow, to bring in test kits? My question, why I ask that is because
Trevor, do you mind just speaking up a little bit?
is there an approval list of persons who bring in test kits? If so, is it public?
I see. If you're speaking about what items can be imported, because there are certain items you have to have permission to be able to import various things of medical supplies, such as kits. Offhand, I know the Cabinet Office is an approved importer. Helix Lab is a approved importer. Ministry of Health, Dr. Weldon. And I actually believe those are the only four. I stand to be corrected, and I can confirm that tomorrow, but you do have to have be listed as one of the approved importers.
How does one get on the list?
I need to confirm that as well. I believe that's through an application through the Chief Medical Officer, but I need to confirm that. I don't have all those particulars right now.
If an unapproved person is bringing in test kits without authorization, can approval be given after they have been landed?
Again, I'll need to get more details about that. I do understand that Customs have implemented various restrictions to ensure that things that are imported in Bermuda meet with World Health Organization criteria, but I'll get more details about that tomorrow. I don't have that information offhand.
I'm aware of a situation where some tests were brought in, the Customs denied it, and it was overruled. A decision was overruled by, shall I say, Mark Talamac, who gave the authority, and how can one make this approval without going through the Minister of National Security or the Collector of Customs?
Let me just make clear that no decisions are made by public officers, and I don't think it's best to try to call public officers names. The government of Bermuda are the people, and the cabinet are the ones who make decisions. The fact is that you can only look at examples such as the United Kingdom, where they bought 17.5 million test kits, and they found that those test kits were faulty. So there is a very rigorous process that has to be followed, and what we are making sure is that any testing kits that are brought into the island are going to be validated and verified, and that is something that is going to happen with the blessing of the government of Bermuda. But I think what is important, Trevor, in this particular case is what we have to realize is that many countries around the world are improvising. Just as in last week when we ran out of viral transport media and our health department had to improvise to make sure we can continue our aggressive testing, we are going to make sure we improvise throughout this process. But we are not going to compromise the health and safety of the people of the country.
Thank you, sir. Minister Keynes, I have a few questions for you.
Cannot hear you,
reference
kind
to the.
You gotta
I
speak
have a
up,
few
sir.
questions. I have
Cannot hear
a
you,
few questions for you. Reference to the prisons, the POA that have some extreme concerns. They have, in previous times, they've made rooms available for inmates that might come in that possibly might. I'll put it this way: they've had COVID rooms put aside. These rooms, these cells at present have taken up those that are violating the shelter in place or the curfew. It's a crisis up there now. How does, have you been aware of the situation? That's my first question.
Thank you for the question, Trevor. Firstly, I reject the notion that there is a crisis in our correctional facility. I believe the information that you've been supplied with is incorrect, and let me help you to work through it. At present, there are approximately 130 inmates at the Westgate Correctional Facility. There are 220 cells. Out of the 220 cells, just under 30 of those are under repair and inoperable. We have the opportunity to have 14 quarantine cells. So when a person comes in, if they have been sent there by the magistrate, persons are being housed in the quarantine cells. If they come back from the hospital, they are being housed in the quarantine cells for approximately 14 days to make sure that they are healthy. They are being monitored. We have 4 isolation cells. So let's just go back for a bit. We have said in countless press conferences that we had a pandemic plan. The pandemic plan was shared with the Prison Officers Association, and it was shared with the inmates. When they have the weekly meetings, members of the Prison Officers Association are present in those meetings. We cannot go into specific details about the entire plan because there are security concerns around that. But we have a rigorous regime of cleaning the prisons. We also have other facilities that we can also move people around. If anyone has concerns, they can, number 1, speak with the acting Commissioner of Corrections, and number 2, they can reach out to me directly. I have a awesome working relationship now with the POA, and I'm always willing and available to work through any significant issue with them, whether it's great or whether it's small.
Has there been any consideration to release inmates that are low risk or got very little time left to make room?
Of course there is that consideration. Remember, we have a pandemic plan. We are not going to, on day 1, before there are any COVID positive persons, just start releasing people. We have a plan, and it is a plan that is contingent on specific things happening. There are a number of considerations that are contained within that plan. We believe because of security reasons, we cannot disseminate that entire plan to the general public.
Has any inmates been tested to date, I should say?
The concern that we have is that what we're doing is, as we are doing island-wide, making sure that an ounce of prevention is better than a pound of cure. We have the PPE kit that is available. We have significant cleaning regimes, and we have the opportunity to monitor into when an inmate comes in. If they were sentenced by the magistrate's court, they don't go directly into one of the housing units. They stay in one of the 13 quarantine rooms that we have. And we have, if things do escalate, and they have not, we have an isolation room, isolation cells that are available.
Premier, I want to ask you a question, my last question. Being proactive, we know that we have some perilous times ahead of us, some dark days. When would you think be considered the right time to talk to the community, to the island about these days that are ahead of us? You're going to have 2-member families without half of their income is going to be cut. So how are you going to prepare the island for what's down the road? There's still a lot of people that are buying for today and not thinking about tomorrow. When would you consider being an appropriate time?
Well, I think that I have alluded to that at many times when I have these press conferences at 5:30 in the evening, when I've spoken about the fact that we are going to be experiencing difficult economic times ahead. And I think the Minister of Finance has also said that, and others. But I'll continue to communicate with the people of the country, as this is something that is, from our perspective, it is going to be a very bad economic shock. But the government is also focused on the future, and any crisis, there's also an opportunity. So our job is not necessarily to be sad. Our job is to recognize the challenges which we have, they play the cards which we're dealt, and make sure that we work collectively as a country in order to rebuild this economy. Last night, you heard it be announced that we've put up on forum.gov.bm, and we want to hear thoughts and feedback. I had a meeting today of the Bermuda First Group. We've been collaborating with members of the opposition and others. We want to make sure that we can work collectively in order to make sure we rebuild our economy. So we are going to do that as we move forward. Thank you, Trevor.
Minister Kim Wilson, my last question. Are you aware that patients are being tested by private clinics and given results? Are you aware of this?
I know that the verified lab that is being used by the government is being run by Dr. Desiree Spriggs, which is the Helix lab, and it has been validated by PAHU and Public Health England. As the Premier has previously indicated, Dr. Karika Weldon is also in the process of setting up a lab at Southside that's also going through the verification and validation process. I have been made to understand, actually as recently as a couple hours ago, that there may be some other type of testing that's taking place on island. I can't speak to the veracity or the verification of that, and I suspect that more information may come out of that as a result. That's pretty much all I can say at this point.
I noticed today at one of our local grocery stores that the management were checking their staff by reading their temperature. Mm-hmm. Do you promote this throughout the majority of the grocery stores and the seniors' homes?
Well, I can speak for the seniors' homes that they have been provided with thermometers, so they check their residents' temperature on a daily basis. Sometimes it's the old-fashioned way by putting it under their arm, but there are a number of them that do have the, I don't know the technical name, but it's like a scanner. You just kind of aim and point, and it registers the temperature on the particular device. So they are. I can't speak for the grocery stores, but certainly for the seniors' homes, they have been provided with adequate thermometer devices so that they can regularly check and monitor both the staff as well as the residents insofar as their temperature.
Cases today, are they connected with the rest home, or are they connected with any other known cases?
One of the cases is actually still currently under investigation, and the second case is connected to a charter flight from the United States arriving on the 8th of April, connected to a cruise ship passenger.
Also, in the absence of a vaccine and with no results yet from clinical drug trials, blood plasma therapy is again showing benefits to critically ill patients. It's an age-old treatment which goes as far back as the 1890s. Doctors in China, Italy, and the U.S., etc., are using it. Does Bermuda have a lab with a centrifuge that can process plasma from recovered patients? And is this a treatment that is being considered in Bermuda? The doctors would need to be screened for viruses such as HIV, hepatitis, before the plasma could be given back to the sick patients.
Okay. This obviously is a question that would be better suited for BHB. However, they have been provided me with some details that may be able to assist you. And this is directly from Dr. Ashton. Although there is still an unproven treatment for COVID-19, he does believe that there's a promising avenue to be pursued based on recent publications. The treatment is feasible at BHB, and Dr. Feluke, who's the hematology, has written a protocol which is being received initial approval from the ethics committee of BHB, and they are awaiting final approval from ethics and from the board of the BHB. And in the interim, they've asked GPs to reach out to their patients that have recovered from COVID-19 to consider volunteering for donation of plasmapheresis. Donor eligibility would include all adult men and all adult women older than 50. Recipients' eligibility would be those patients critically ill and expected to die otherwise. However, this use would be on a compassionate basis and the outcomes tracked by a registry, and the protocol can be made available. But again, I'm quoting actually Dr. Ashton to assist in facilitating a response for you.
Thank you.
So to be clear, Don, yes, the hospital, as we've said, is pursuing all avenues. As the Minister of Health said, we've gone down that road as well.
I appreciate the real simple answer as well. Mr. Premier, yesterday you spoke of leading stakeholders, and you mentioned Bermuda First just a few minutes ago as you plan for the economic recovery when restrictions are lifted. Are there any specific ideas that have been suggested so far that stand out?
I would say I'm not going to get into the specifics. I think there's a lot. What I want to do is continue to encourage persons to share their thoughts at forum.gov.bm, and persons also share their thoughts with me on social media as well. The fact is that the Minister of Finance made it very clear yesterday that nothing is off the table. We're not saying that anything's off the table. I have my Dennis Pitcher, who's working on things with the future of the digital economy, as one of the things people want to use less of is cash and otherwise. We have had companies that have indicated interest in assisting with those things, and also companies that have indicated in their desire to relocate to Bermuda when things clear. So, I mean, and that is certainly a benefit and a boon to some, and it changes our way of doing business. But I think that it's helpful, and it's helpful that Bermudians are now inside of that mindset of, you know, being able to go ahead and shop online for local wares. So I think from that perspective, it is going to mean a difference in ways of doing our business. But one of the things in which we're focused on is how are we going to be able to reopen our tourism industry? And that's a very difficult question. It involves ramping up our testing capability, figuring out how we can make sure that persons will not be re-importing the virus to create additional clusters. And so that's where a lot of energy and effort is certainly going into, because that is a very large employer, and recognize that cruise ships are predicted to come this season until possibly late, if so, and others. That is certainly a big challenge for us.
What has the general feedback been from the business community to you today?
Well, I think that the feedback has been supportive. overall. You can see from the fact that the countless donations of which have been made either to the Bermuda Community Fund Emergency Fund or, the Bermuda Community Foundation's Emergency Fund, and also the donation which we announced today to Bermuda Hospitals Board. And I think there's other donations which have come into place. So I think that's certainly something that's healthy. What I want to continue to do and encourage a spirit of collaboration and to say that this presents an opportunity to remake and to transform Bermuda. And so we're going to have to be very bold as we go forward. And but I think what's important of me as a leader of the country is to resist the temptation that some may want to devolve back into political tribalism. It is now a time for unity. It is now a time for us to look at how can we come to commonality on a lot of these different issues and push, because political tribalism at this point in time will only set the country back, and that is exactly what we do not need.
Countries across the world are grappling with exit strategies from their shelter in place. What metrics will you be looking for before you push for these restrictions to be lifted?
An excellent question. What I would say is that I think the Minister of Health confirmed that the modeling information might be finalized over the weekend, so by next Monday we'll be able to release that. But a preliminary stage of that is, and this is what all countries are dealing with, and I kind of went into detail of it yesterday, that if you go through a very strict suppression phase to give your health system time to prepare, to get your testing up and running, so in a place where you can actually begin to lift those type of restrictions, if you lift them too early or too quickly, all the time of which you sacrifice in shelter in place will be for naught, and you'll find yourself having to put down that strong hammer again. We're not going to fall necessarily into that mistake or into that trap. So what we're going to have to do is to just find additional flexibility. So that means that when the shelter in place is done, we might go back to the place where we were before, where it was only curbside and takeout for restaurants, for instance, dine-in and different things. But we're going to do that based upon the critical care capacity that we have inside of our hospital, because we have to recognize that there will be persons who will get sick from a very contagious virus. But what we don't want to happen is for persons to not have the ability to have space inside of either a hospital or to have access to critical care equipment, such as ventilators and others, in the case that they need and require that care. So that's the delicate balance which we have to have. That was a conversation which we had in Cabinet, where the Minister of Health is working with her team to do further work on that modeling, so we can actually have an idea of when we need to tighten and when we need to loosen. So it's a very delicate dance that you have to do through time until, as you say, there are vaccines. But every day and every week, there are new advances being made, more research that's being done when it comes to the coronavirus, the novel coronavirus, and the disease which it causes, COVID-19. So we're learning more things. There's more effective ways of treatment which are going to be learned, and so that will basically give us more room as we go forward. But right now, the only thing we have are non-pharmaceutical interventions, and we're going to have to continue to exercise those, such as social distancing and making sure we maintain good hygiene.
Thank you.
Thank you, Don.
Thank you, Mr. Premier and Ministers. Mr. Premier, we've been hearing of some continued abuses of employees. Apparently, there are some people that are still being compelled to do some form of work, even when they're receiving government, the unemployment assistance. We're wondering if you've been hearing of abuses. Are they easing off? And if you could give folks a reminder of how they can report these abuses if they feel they're being taken advantage of by their employer.
Well, thank you very much for the question, Jonathan. What I would say is that we do have an online form which is completely anonymous, where persons can go ahead and report any of those breaches which may be taking place. I believe that form can be found on on coronavirus.gov.bm, and there is a link to all COVID-19 forms. You can go there, and then you can find the forms to go ahead and to report any employer who may not be abiding by the rules. It is completely anonymous. That information does not come to me, Jonathan, so I think it goes directly to the Ministry of Labor, Community Affairs, and Sports, who is responsible for the enforcement of those particular things.
Thanks, sir. Looking back, we wanted to find out if you would have would you have stopped or quarantined visitors from places that had COVID-19 earlier than we did?
I mean, we did it very early. Minister of Health, I mean, we had bans in place from January.
I mean, hindsight is always 2020. It's
Yeah.
always easier to look back and reflect. However, we probably stopped the entry of visitors from high-risk jurisdictions very, very early on. And one of the earliest countries actually that reported those type stoppages, so to speak. So we did do it quite early.
And did the peculiarity of being an island and preserving our economy, did that put us in somewhat of a predicament with imposing restrictions?
I mean, there was some early pushback from the early restrictions in which we put in place, and there were some particular challenges there. But as the Minister of Health said, we did put in place some travel restrictions very early inside of this particular virus. And we do know that there were some representations from certain countries who were added to the list early, saying that they probably do not deserve to be there.
Thank you for that, sir. So some medical questions that have come my way. Of the folks, I think you said there are 9 people in the hospital. Do we know how many are on ventilators or in ICU? Do you have that information?
I don't have that information, actually. I believe there are 3 that are on the ICU unit.
We've heard this before. We wanted to know if in terms of racial data of people who are falling ill, if we're collecting that information or if we are able to give even a general breakdown of how that looks.
Right. Like I said, Jonathan, that is information that we are trying to attempt to collect. I have asked the team to assist in facilitating that. However, as I've indicated previously, the majority of the test requests are coming from the physicians. They fill out the form sent in. We then have an appointment for the individual to come and get swabbed within the community. Again, it is a little bit generally easier to be able to look at somebody and see what their sex is by looking, but it's not that straightforward with respect to the race. But I do appreciate that those are questions that members of the community do want to have that information, and I have asked the team to see how best that they can facilitate that.
Thank you, Minister. Regarding the second care home, and the Chief Medical Officer gave a full explanation for why she's not prepared to give the name of it, and we hear that. The question we had, though, is if the positive case had no contact with anyone for 14 days or longer, we could see not naming. But, I mean, in the light of it, does the public not deserve to know? Can we revisit that?
Well, I think the Chief Medical Officer...
14 days without contact.
Certainly, I understand your point, and I think the Chief Medical Officer's concern principally is the fact that because it doesn't necessarily represent a public health risk, that there's no need to effectively identify the individual. I'm certain if you had a family member that had tested positive for COVID, notwithstanding that they probably had recovered, they may choose not to have that information made public.
One thing we're still not clear of, and we wanted to ask, you did mention just now that there were challenges to do with the restrictions on staff going between different nursing homes. Why didn't we ban nursing home staff from moonlighting at the same time as we banned visitors to nursing homes?
That's a very good question. There are some economic considerations. There are certain persons that actually probably do rely on another source of income with respect to working on multiple homes. We've been working with the nursing homes since the Public Health Emergency Response Team started meeting in January and trying to encourage them to dissuade persons from going to multiple homes. So we were hoping that that process could have been taken place voluntarily, and as a result of it not doing so, that's why the government decided that we'd have to amend the regulations to effectively legislate and require that persons only work at one principal home.
Thank you, Minister. Are you able to tell us where we're at in terms of the, let me make sure I get it right, the serological tests, that's the antibody-based tests, are we looking still at getting them, or is it still early days to?
I'll yield to the Premier on that one.
The serological testing, there's a number of things that are being done from the serological testing perspective. As I indicated when Trevor had asked his particular question, what we do not want to do is to procure tests on island that are not valid tests. And so if we get tests, then we have to go through a process of validation and verification if we do get these particular types of tests. I think what is necessary and important to recognize is that this is something that will certainly aid in the diagnosis, or not necessarily diagnosis, but aid in the, I guess, management of this disease. Understanding who has been infected, understand who may have temporary immunity is certainly something that is particularly important in this. So I know that a lot of purposes have called for that, but as we've seen examples in countries like the United Kingdom, who ordered 17.5 million of them and they did not work, we don't want to find ourselves in a circumstance where we order 60,000 or 80,000 and they don't work. I can say there's been no shortage of persons who have tried to sell the government serological testing. We're going to be very careful, and any serological testing that may come on island will have to be tested and validated. And then we will go through that process if there are not other countries that have done it.
Thank you for your answer.
Thank you. Do you want to just do a clarification?
Just for some further clarification in detail, tomorrow we'll be further dividing the last name shopping.
Not starting tomorrow.
Excuse me?
Not starting tomorrow.
Excuse me. Tomorrow, when we come to the meeting tomorrow night, we have the last name shopping schedule in 2 tranches. Tomorrow we will introduce 3. And so people have been going out and they've been panic buying today. Tomorrow we will share with you the new schedule for shopping, which will be 3 segments instead of 2, and we will be shedding some light on some new days of the week to travel. So people do not have to panic about going out and standing in long lines. We believe we have a new system that might add some relief to the long lines that we're seeing, Mr. Premier.
All right, excellent. Thank you very much, Minister Keynes. Just I want to remind everyone, tomorrow at 10 a.m., Bermuda's House of Assembly will be meeting. It will be able to be watched online, as we'll be meeting virtually, and I ask that you will tune in to that particular proceeding so you can be informed. Tomorrow evening, we will be here at 5:30 to be giving a full update on not only where we stand with testing, the updates from the Minister of National Security about what will the next 2 weeks of shelter in place look like and the various accommodations which may be made to ensure that persons are able to access items before they run out. And finally, we hopefully will have some good news to share on testing. So with that, I wish everyone a very wonderful evening.
Thank you, Speaker. I just want to make a clarification. I don't think it was
COVID-19, otherwise known as the novel coronavirus, is changing the way we live, work, and do business in Bermuda. It's also
Thank you, everyone. Have a nice evening.
This is a message from the government of Bermuda.
COVID-19, otherwise known as the novel coronavirus, is changing the way we live, work, and do business in Bermuda. It's also changing the way we shop. Here are some tips for grocery shopping during the COVID-19 pandemic. Before you go to the store, consider whether you really need to go shopping. If available, consider delivery options instead. Don't bring the whole family, as only one person from a household is permitted, with the exception of single parents.